So our first class is about the aging experience. We'll be talking about the aging population and life transitions, which is your chapter 1 and 4 from your objective of this class. By the end of this class, you will be able to explain the different ways in which older adults are viewed and myths that are associated with older adults. We will be describing the characteristics of older adult population. And also you will be identifying factors that promote a healthy aging. So what does the Quran say about old people? Think about it and let me know in the chat box. Okay, so in general, numbers have increased over the past 5 decades. The goal of each and every human being is an everlasting youth because everyone likes to stay young. The aging process is very complex. However, we will try to explain it from the different. So who are the older adults? Older adults are individuals of age 65 years and above, categorized in four main groups. So young old, who are 60 to 74 years, middle old, who are 75 to 84 years, old, who are 85 to 100 years old, and then centenarians who are over 100 years old. So there is an increasing health challenges with age, as you may notice. Also, diversity of health problems and social needs increase with age. So for example, they will be having a lot of chronic diseases that they need to deal with. Older adults are 5% of the Omani population. However, they are increasing in numbers and they are expected to be increasing dramatically because of the increase in life expectancy in Oman. So the life expectancy at birth from the total population is 74.22 years. The Oman's life expectancy have increased from 50 years in 1970 to 73.9 years in 2010, and it has increased more and more. So for males, it is 72.38 years. For females, the life expectancy is 76.16 years, which is higher than the male. Worldwide, female live longer than men, which is have a lot of implications for older adults. For example, men they get cardiovascular disorders very much younger than women, and there are a lot of theories around this, and scientists are thinking that it is because of the estrogen. So what are the factors that are influencing life expectancy? So number one, there is an advancement in disease control and health technology. So for example, today we have, if someone used to have atrial fibrillation, there are no devices that can be put in his heart to synchronize his heartbeats, right? But today we do have those technologies. In addition, there was no, for example, cardiac catheterization, and today we do have cardiac catheterization. So there is more advancement in disease control. Also, lower infant and child mortality rates, as you may know. Also, there are a decrease in fertility rates. However, still the life expectancy is increasing. Okay, and then also there are improved sanitation. And what do we mean by this? So if you recall, there was sometimes where you have heard, I'm sure, from people who are elderlies in our community, that in olden days they didn't used to have good sanitation. For example, there was no toilets, there was no good drinking water. There were a lot of people who got malaria because of the very hard times that they have and the low sanitation. People are living also in better living conditions, and there is a better economy. so people can get better medications, they can get better health care. Also, there are some epidemiological transitions. For example, people used to have a lot of communicable diseases like cholera, malaria, and so many other diseases. However, now we see that there is this disease transition from communicable diseases to non-communicable diseases like diabetes mellitus and hypertension. There are also some changes in the social aspects of older adults, especially around like in America or in Europe. However, we don't see it evident here. But the rural living is more preferable by older adults than when they are younger. We don't see this very much evident in our community yet, but I wanted to talk about and to bring it up so that you know what kind of changes are happening worldwide. So people are living in the rural areas also because it's more calm and they can do their activities. Older adults, they tend to like calm life and a more peaceful life towards their end of life. Another aspect of social aspects of older adults is income and economic. So there are 10% of older adults who live below the poverty level, and this is a very important point to keep in mind when we are dealing with older adults because they don't have income or they don't have enough income and they are very much dependent on their kids or their family members. Also, in terms of education, there is an increased level of education in the older adult population, which is like for this new generation that is going to be older adults. So, which is going to impact their health. Um, we will see patients who like to be informed and who like to be involved in decision making. Okay. There are also some changes in their health status, like for example, they do get a lot of acute conditions, so fewer acute illnesses, but more longer period of recovery, and they tend to experience more complications. They tend to have also more chronic conditions. Um, they have, so most of the older adults, they mostly have at least one chronic disease, or many they have multiple comorbidities or multiple chronic conditions. The most famous or the most important chronic conditions or the most common chronic conditions that we usually see are diabetes mellitus, hypertension, heart failure, COPD, and asthma. These conditions or these chronic conditions are the leading cause of poor self-care, the leading cause for disability, and they do need a lot of family support and family caregiving. I wanted to bring here that one of the very important topics that we need to talk about is activities of daily living. So what do we mean by activities of daily living? There are two types, basic ADLs and instrumental ADLs. Basic ADLs including bathing, dressing, eating, toileting, and transferring or mobility. Instrumental ADLs are something or the activities that the older adult is using an instrument like light housework, preparing a meal, taking medications, shopping for groceries, using the telephone, or managing money. The 10 leading chronic conditions that are affecting the older adult population, as I mentioned before, um, I have mentioned 5 of them, but there are also some other chronic conditions that I didn't mention here, including arthritis, hearing impairment, visual impairments, deformities, chronic sinusitis, hay fever or allergies, and varicose veins. Those are lists debilitating chronic diseases than the one I mentioned. But of course, the leading causes of death in older adults, number one is heart disease, number two is cancer, and number three, cerebrovascular accident or stroke, which is number two in Oman. And number one in Oman is again heart disease, and number two is cerebrovascular accidents. So practice question, and I want you to answer this question in the chat box. Which statement about aging in older adults is correct? Female older adults have longer life expectancy compared to men. Older adults are mostly money rich and asset poor. Older adults, when hospitalized, they tend to recover quickly. Older adults present more with acute health problems. So let me know what you think. Okay, another very important social aspect or a healthcare aspect is provision and payment of services. Like, for example, having hearing aids. So are they able to pay for their hearing aids? Are they able to pay for their glasses, for example? So we are very lucky here in Oman that our government is paying for elderlies actually. But there are other communities where services are not free. However, this is still something to consider in our community that, for example, they will not be able to, there are still services that they need to pay for themselves. For example, getting the glucose monitor, and then also getting a baby cuff or a baby monitor machine, and also, for example, getting an eyeglasses. Okay, so this is one of the topics that I would like to discuss with you in our virtual class or synchronized class next week, which is myth of aging in the Omani society and how can we avoid discriminating older adults. I want you to think about this and we will discuss it next week. So let's talk about myths of aging in general. So what do we call about myths of aging? These are misconceptions or misinformation that is not fair to be attached to older adults, and it can lead to a lot of stereotypes and discrimination. Your role as a gerontological nurse is to know the facts versus myths, to educate patients and families and the public to not discriminate older adults. In many cultures, older adults they are very much respected, like the Omani culture, like the Eastern cultures in general. In other societies, aging is synonymous with death, so they do associate aging to death, and they think that younger individuals that they have negative views of aging process. Um, there is this fear and lack of exposure to older individuals can contribute to ageism. So someone who never been dealing with older adults, he might be having what we call ageism, and we will talk about this. These are, I've listed here more myths of aging, and you can go through them. And I believe that some of us do have these myths, and we need to change them around if we face anybody with that. So why is it important that we need to fight myths or like make them clear in our community? Again, because we want to avoid what we call ageism, okay? And we want to avoid segregation of elders from the mainstream society. So we want to involve them in our society. Some of the misconceptions about older adults that I would like to present here, that many people, they think that older adults are sick and disabled. They also think that they are in nursing homes in some other countries, but that's not true. That dementia comes with old age, and that people are either very tranquil or cranky as they age. Older adults have lower intelligence and are resistant to change. And then also they think that one of the misconceptions, also the very important misconceptions, that the older adults are not able to have sexual life and are not interested in marriage. There are few satisfaction in old age. I'm sorry, I have a typo here. So, but what I mean here that they mean there is this misconception that older people are never satisfied about. So, what do we mean by ageism? Ageism is a concept described as the prejudices and stereotypes that are applied to older people only on the basis of their age, which is discriminating older adults based on their age. Ageism in our society is not so obvious or clear. However, we need to pay attention because we do have elderly abuse because of ages. Practice question 2. Which of the following statements demonstrates ageism? Older adults are slow because they have reduced intelligence. Older adults tend to live in rural areas. Older adults are complaining of sickness all the time. Older adults are mostly affected by chronic diseases. Please answer the question in the chat. The nurse states that I do not teach patients about sexual health because older people do not engage in sex. The nurse's statement is an example of biological changes associated with aging, cultural sensitive care and healthcare, ageism in healthcare, cost containment in healthcare. Transition and story. Many life changes occur in older adults, like, for example, um, they may be change in health status, change in family, change in social support. There are also many life transitions like retirement, loss of spouse. All of these life transitions make the older adults um, like to tell the story of their life. Like, for example, if they have been involved in a war, or they like also to talk about what they did in their previous life, in their work, how they lived in the past, how life was in the past, how enjoyed their life in the past. There are also many changes that may happen in the relationships. For example, parenting. So their kids are growing. They may be now at the grandparent stage. They may lose their spouses, and as I said, they may face retirement. So when there are changes in parenting, as I mentioned, there is this sense of loss that the mother, for example, is feeling that her kids are no more younger kids, and now they are very independent. Grandparenting, older adults, they do enjoy grandparenting because they feel it's a new role in life. They feel that they can give, and this is one of the learned roles. So they are much more, for example, lenient and nice with their grandparents. They deal very much in a very softer way than when they were dealing with they're not more strict as they were dealing with their children. Discussion, grandparenting in Omani society. This is one of the discussion points that we'll be discussing again next week in our synchro. Loss of spouse is one of the very important changes. and it's a very common event, and it alters family life. So there are a lot of adjustments that a widowhood to widowhood now that the elderly need to adjust or cope with. For example, developing alternative rules, like for example, if the wife used to cook and the wife is the one who died, then the husband now need to take that role. There are income issues also associated with that, and also there are uh, changes in many lifestyles. Retirement or loss of work. This is a very important point because it is very much associated with reduced income, and the older adults have to cope with that. They are now they need to identify another job or work. They need to find another source of income. So with the retirement, there is this sense of identity that might be affected. So as a gynecological nurse, we need to be. There are many phases of retirement, or let's say there are phases to retirement. The first phase, which is a remote phase, there is an anticipation but not preparation that that the retirement is coming soon. The near phase is preparation for leaving begins. So there is preparation in the near phase. The honeymoon phase, which is euphoria immediately after retirement or being excited to retirement. Disenchantment phase, which is stabilize and let down depression. So there is a depression because there is this sense of identity that we talked about that might face the older adult. Reorientation phase develops a new lifestyle which gives satisfaction. Stability phase, which is understanding the retirement role, and termination phase, where the older adult will be the retirement role will be lost with the resumption of work or disability or illness. So they will be forgetting that they have retired. Nursing intervention are very important for each phase. So by understanding each phase and by understanding the psychology behind retirement for older adults. Reduced income, for example, is a very important challenge and issue that comes with a retirement. So the older adults need to adjust with a reduced income. So living in a smaller house, for example, buying less things than before, spending less money in general, and they may be independent or dependent on their. There are also many challenges in health and functioning. So elderly they have to cope and adjust with this new body image, like for example having gray hair, and we will talk about this in depth. Also effect on self-concept, or like how they view themselves and their roles, changes in roles. Also acceptance of their bodily changes, like for example if they are having scoliosis, if they are having, for example, wrinkles. A point of discussion: what is the role of nurses to help older adults cope with advancement in age? So again, we'll be discussing this next week. Nursing interventions for decline in functioning. Number one is to teach the elderly the common changes of aging, facilitate optimum functioning, so make them more independent than dependent. Uh, Also by promoting health, like for example, teach them health promotion activities such as, for example, adherence to medication, um, for example, monitoring their symptoms and taking healthy food. Disease prevention by, for example, taking flu vaccines, by taking, for example, aspirin or clopidogrel, and preservation of independence. So we'll talk about this. So life transitions, we have talked about some of the life transitions that older adults may face, but there is a cumulative effect of these life transitions in like cumulatively they can affect the older adult in a negative way. For example, older adults, they will have shrinked social world, so they will be with certain friends only because some of their friends have died. There is this risk of loneliness that we need to pay attention to, and there is also potential failure to thrive, so the elderly will not be able to live or thrive effectively in life because of all the changes that or the life transitions that happen. For example, loss of spouse. At this stage, they are more aware of mortality, so there is this heightened awareness that death is a reality, and they will start accept the fact or the reality of death. Our nursing intervention again is to pay attention to loneliness and isolation and try to understand the psychology of older adults when they have a life transition, such, for example, loss of spouse. So, how do older adults respond to life transitions? Some of them, and most of them, do have coping mechanisms with these life transitions. Also, some of them they do have depression, for example. They do have failure to thrive, as we talked about. But our nursing intervention is again to give them the chance to review their life, talk about it freely, eliciting their life story, like, for example, tree of life, timeline, life map, or what happened by talking or drawing or writing it. And again, to promote self-reflection through writing letters or emails or journaling, for example. And in our society, mostly by telling stories. So, encouraging a life review and life story is an intentional intervention. So the nurse would be asking the patient to talk about their process or their experiences, their past experiences in a good way. Like, for example, if you face a patient who was acutely admitted for an acute disease, for example, in the hospital, and you see that he is calm and not talking, maybe he is feeling lonely, so you need to sit with them, talk to them, and uh, ask them to tell you their stories and what happened in their life. So, as we mentioned, self reflection can be done through journaling, writing, reflecting through, for example, expressions, and through, for example, telling stories. It is a very important part of coping with life transitions. Strengthening inner resources, like, for example, physical, emotional, and spiritual resources of the older adult himself, is very important. So, for example, behaviors that exemplify survivor capabilities, for example, that they cope with the disease, they try to seek help, is very important to strengthen inner resources. So in this lecture, we talked about aging in common. The common changes that are associated with aging, that aging is increasing in our society, and that aging is associated with many life transitions or changes which have health implications. There are many nursing interventions that we need to consider when when an older adult face life transitions.